You wake up, your chest is burning, and your upper stomach feels heavy. Like most people, you assume it's just something you ate. You pop a standard antacid. Within minutes, the burning fades. The medication does its job, and you go about your day believing the problem is solved. But that temporary relief is hiding a much larger issue. For millions of people, this recurring heartburn is an active, living bacterial infection. In developing regions like India, up to 80% of adults are silently carrying a bacteria called Helicobacter pylori. Looking at a typical crowd, the majority of people are infected without even knowing it. Taking an antacid for this kind of chronic discomfort turns off your body's alarm system. It mutes the symptoms, while the actual disease continues to damage your stomach lining completely unchecked. Under normal conditions, your stomach is an extremely hostile environment. With a pH level between 1 and 2, the acid is corrosive enough to destroy most invading microorganisms almost instantly. Yet, H. pylori manages to survive in this extreme acid bath. Where normal bacteria die in seconds, this spiral-shaped microbe settles in permanently. It does this by deploying a specialized chemical tool, an enzyme called urease. The bacteria uses that urease to target urea already present in your stomach and convert it into a different compound, ammonia. This ammonia immediately neutralizes the local stomach acid. The bacteria essentially builds a microscopic neutral shield around itself to repel the corrosive liquid. By engineering its own safe zone, H. pylori bypasses your body's primary defense system entirely. Protected from the acid, the bacteria burrows deep into the stomach's thick mucus layer and attaches directly to the delicate cells underneath. Your immune system detects the invader and dispatches white blood cells to the area. They release inflammatory chemicals, triggering a localized war inside your gut. Because the bacteria is so well shielded, this microscopic battle doesn't end quickly. It drags on continuously for 10 to 20 years in a steady state of chronic inflammation. Over those decades, the stomach lining slowly weakens and thins out. Without that natural protection, your own stomach acid burns the exposed tissue, causing painful, sometimes bleeding ulcers. If left untreated, this constant cycle of damage and repair forces some of your stomach cells to mutate their physical structure. This is a precancerous condition that drastically increases the risk of gastric cancer. The clinical data on this mutation is clear. The World Health Organization officially classifies H. pylori as a Class 1 carcinogen. You might only feel mild bloating or occasional heartburn over the years, but the absence of severe pain does not mean you are healthy. The decades-long unnoticeable damage is exactly what makes this infection dangerous. If you start experiencing sharp stomach pain, unexplained weight loss, or pass black stools, you have moved past simple indigestion. These are severe medical emergencies, signaling internal bleeding or advanced structural damage. To confirm an H. pylori infection before it reaches that stage, gastroenterologists use a highly accurate, non-invasive method called the urea breath test. You swallow a pill containing marked urea. The bacteria's urease enzyme immediately breaks it down into carbon dioxide. This gas travels to your lungs, and you exhale it into a machine that detects the specific trace signature. Once confirmed, the infection is entirely curable. Doctors prescribe a strict 10 to 14-day protocol of targeted antibiotics, combined with acid-suppressing medication to eliminate the bacteria. You can then support the healing process with high-fiber foods and probiotics to help rebuild your gut microbiome after the heavy antibiotic course. Chronic recurring acidity is a solvable medical issue. Getting a proper diagnosis and finishing the treatment course stops the infection, reverses the inflammation, and completely halts a decades-long progression toward cancer.